We can discuss this now with Dr. Adam Hamawy. He's a plastic and combat trauma surgeon. He volunteered with the Palestinian American Medical Association, providing critical medical care in Gaza, and he's speaking to us from Princeton, New Jersey. Doctor, it's good to have you on the program. You yourself have seen firsthand the difficulties that medical personnel in Gaza are having, and now on top of that, there are more diseases. From the people you're still in contact with, what are they telling you about the conditions they're facing in the Strip?
Well, the conditions, well, thank you for having me. And it's unfortunate every time we talk, it seems like it's getting worse. The conditions, last I spoke to with the families that are there, is in addition to the bombing that's been going on, they are now in a state where many haven't eaten for days at a time. So I'm in contact, for example, with a family that's up in the north and close to Gaza City. They haven't eaten in over 3 or 4 days. The father of the family is, everyone's concerned because he has to go to these humanitarian aid stations to try to get just a bag of flour or anything. And every time someone travels there, there's a risk of getting killed just to go provide the most minimal amount of food. So, and as we heard, the bombing today, over 100 people seem to have been killed in Gaza City. So that's, hasn't stopped since the beginning. So conditions are not getting better at all.
They really just seem to be getting worse every single day. And now with this report coming out that there's the spread of diseases that are resistant to antibiotics and to drugs. And when you're in a war zone with very little access to medication, how do you as a doctor or a nurse even go about starting to treat a patient who has such a disease when there are so many medications that simply aren't available in Gaza?
Well, this resistance is really because of the blockade that's happening. Normally when we try to treat any kind of infection, there's a process that you go about. We need to find out what the bacteria is, and normally we send cultures and try to get the results about what it's resistant to and what's not, and you choose a drug that's specific for that organism. Unfortunately, this really doesn't exist. There's only like 1 or 2 functioning labs. It takes weeks at a time, sometimes just to get the results. And often you don't have most of the antibiotics available, if you have any at all. So some aid workers come, and whatever supply they have, they're basically randomly selecting what's available to treat whatever is currently in front of them. And often it's not the right drug for that disease. And that results in more resistance because often you can't even continue it. You're giving what you can for a few days when, for example, you might need 2 or 3 weeks to actually eliminate the infection. And so when you partially treat an infection with some random drug, next time you come to use it, it's not going to work. And this has been going on now for almost 2 years. And that's why we're in the situation we're in.
One of the authors of the Lancet study said the rise of drug-resistant diseases also means an increased risk of death from common infections. It also means possibly more amputations. Gaza already has so many amputees who, of course, don't necessarily have the access to prosthetics. So the knock-on effects of all of this is huge.
Yes, when I was there, the infection rate was almost 100%. Because of lack of sanitation, because of lack of antibiotics, and also because of the malnutrition. And the malnutrition wasn't even as extensive as it is right now. I mean, this was still early on. People were beginning to, suffer the early signs. And when you're in this state, your ability to heal is compromised. Your immunity is compromised. So it makes you more prone for infections. And then when you come to treat it or even try to recover from surgery, your body doesn't have the capacity to do so properly. So again, this is just continuing to deteriorate, and it's happening deliberately. I mean, this is absolutely preventable. We just need to let medicine in. We need to let doctors and nurses go in to be able to treat, and they need aid. They need food. Everything works when the body, has the nutrition it needs and is able to fight infection and is able to heal. But this is being withheld on purpose. And we continue to allow this to happen. the excuse of fighting a defensive war and still starving the people, and watching children wither away, and watching adults wither away, watching their children die, is inexcusable. I mean, how is this happening in 2025 as the world watches? And all we do is allow Israel to continue doing this. And every time it's allowed to do something, it takes it to the next level. All it does is it sees this as a sign that it's okay to keep doing what they're doing and to make it even worse.
It's difficult to believe that in 2025 there is still famine in the world when it is so preventable. Dr. Adam Hamawy, good to get your take. Thank you very much for your time.
Thank you for having me.